It is heartbreaking, really, to see how people triggered by these unexpected, untoward events in everyday life become quite irrational.
In the past month, a woman was shot and killed in a road rage incident on Route 702 in Essex. A Towson Town Center employee was beaten and hospitalized after a disagreement in the food court. And a man in Anne Arundel County was beaten and killed protecting his son after a middle school fight led to a group of teens and adults showing up at his house.
When we talk about road rage or incidents of unexpected violence in the community, the research shows that it is related to exhaustion. Mental and physical exhaustion puts people at very high risk of being irrational in their responses.
Dr. Richie Gotham, medical director of outpatient services at LifeBridge Health, says road rage incidents doubled since 2018. And just last year, nearly 400 people were shot and killed as a result of impulsive violence triggered by everyday driving-related incidents.
It is a phenomenon which, as we understand and study it, comes from a very primal part of our brain. It's a fight or flight response where you're not actually thinking. You're mostly reactive to what seems like a minor slight, a minor disagreement, or aggressive trigger, and it can lead to some very dangerous consequences.
He says COVID isolation only exacerbated the problem.
Readjusting to what previously was an everyday routine, socializing, meeting with people, sharing our common space are things we have to sort of relearn again. So we are struggling as a community, as a society, and we need to be aware of those trigger points.
By using a mental thermometer, he suggests checking in with yourself and seeing how you feel, taking deep breaths for 5 seconds and thinking about your reaction. Examine previous episodes and decide if something positive came from it, and if outbursts happen often, seek mental health services.
And to be mindful and respectful of each other as humans, as a community, and to identify what bad outcomes or risks frankly, or bad outcomes can happen as a result of irrational impulsivity.
And if you find yourself on the receiving end of the aggression, Dr. Gotham says to do several things. First, don't make eye contact. Try to take some deep breaths and try to get away. He also says try not to respond, call 911, be aware of your surroundings, and most importantly, don't add fuel to the fire. Live from Sinai Hospital, I'm Janine Donaldson for WBAL TV 11 News.